Yes, okay, fabulous. So what we're going to be doing then is we're going to be looking at reflective supervision in a pandemic, because we are slap bang in the middle of a pandemic still, aren't we? So we're going to be looking at reflective supervision. Generally speaking, what I like to do in everything that I do as a social worker is I like to use the what, the why, and the how framework. So this is a framework that I've used for many years as a social worker. If I were going out to see a family, I would be wanting to clarify in my mind what's happening for this family. Why has this situation come about? How is it impacting on the child? How will I work with the child and the family to bring about more positive outcomes? That's what I would always be looking at: what, why, and how. I think the danger is that in practice over the last few years, one of the things that's happened is the why question has fallen off people's agendas, and it becomes very much what's happened, how do I deal with it, what's going on, how do I respond, with a lack of focus on why. That's a real problem for me in many ways, and if we had more time I could talk to you about this for hours, but what I can do is later on put into the chat, or make sure that an email is sent out to all of you with some links towards YouTube videos where I've done more on each of these topics. So if there's something you want to follow up further, there'll be a video that I can direct you to. But this what, why, how is a framework that I use all of the time. So when Eloise asked me to come and do something about reflective supervision, I was thinking, well, shall I just go through what do we mean by reflective supervision? Why is it important? And how do we do it? But then actually the problem with that is that that's a very set structure. It didn't cover everything that I wanted it to cover. So I decided, actually, I'll make sure that by the end of the session, I'm hoping you'll be able to answer, what do we mean by reflective supervision? Why is it important? How can we do it? But actually, we're going to use a slightly different structure. The what, why, how, though, is vitally important. You might have heard of David Wilkins' research. He's based at the University of Cardiff. He's been doing loads of research on supervision in children's services, largely in local authority children and families teams. And when he and his research team listened into audio recordings of lots of different supervision sessions, they were looking to try and decide whether they thought the supervision that was being provided was practice focused and yet also reflective. So they considered the following questions. They looked at, by the end of the session, do we know what the social worker is going to do in the next home visit or the next few home visits with each family that was discussed? Do we understand why the social worker is going to do those things and how they're going to do it? And has the discussion in the session helped the social worker to think more carefully about what they're going to do, how they're going to do it, and why they're going to do it? So one key thing you could look at is, in each conversation you have with a worker, with a supervisee, by the end of that discussion, do they know what they're going to do, why they're going to do it, and how they're going to do it? Is there a clarity of what, why, and how in every conversation that you have with someone through supervision? And that could count in both formal and informal supervision. David Wilkins talks about the golden thread of supervision, and a lot of people refer to that. Chief social worker talks about the golden thread. Ofsted talk about the golden thread. The DFE talk about the golden thread of supervision, and the golden thread is all based on that what, why, and how. So by the end of this session this morning, although I will skip through a few things more quickly than we would have done, hopefully we'll have a clarity of what, why, and how. So in terms of the standards, I am sure that you would be familiar with the fact that there are standards for practice leaders and practice supervisors in children's social work, Department for Education in 2015. But this isn't something unique to children's. Adult social workers also have standards, much more recently developed, the adult standards. But all of those, if I've drawn out of all of those standards in preparing the slides for today, and what I'd say is, even in those standards, the word supervision is seen as, it's taken from Latin originally, the word supervision. So super means over. and VIDAIR is usually translated as meaning sight. So generally, supervision is seen, therefore, as being about oversight of somebody's work or overseeing practice. If we go back in history, if we look at the social work history, in terms of social work history, the early days of social workers, we weren't called social workers, we were called caseworkers. And caseworkers had overseers. And that's really where supervision comes from. It comes from this original idea that social workers were overseen in their practice by somebody more experienced. But now, you know, that's a historical thing. Now, I think supervision has to be about more than simply overseeing a worker's practice. So I find it helpful to go back to the Latin and look at, instead of VIDAIR being translated as seeing or sight, actually the word VIDAIR means vision. We don't need to translate it into seeing, it is just vision. And vision is a key aspect of leadership. So those of you who are in a management or leadership role, you will know that vision is a key part of what you need to do. You need to develop a vision for your team, a vision for practice. That's what you need to develop. But if you're not a manager, vision is still important in social work. The PCF has professional leadership in the domain 9, professional leadership. Vision is all about your vision for practice. What does a good outcome look like in this situation? Where do we want things to get to? That is all about your vision. And supervision should be about supporting a practitioner to develop their vision for practice and to work towards that. So the 3 questions that we looked at are again vital in terms of helping somebody to understand their vision for working with a family or with a young person. So when we're talking to somebody about outcomes, we need to look at, what does a good outcome look like for this family? Why is that important? And how will you get there with this family? And that what, why, and how, every social worker, every youth worker, every early helps practitioner, everybody needs to be able to answer the what, the why, and the how of their practice. What am I doing with this family? Why am I doing it? How is it impacting? We need to be able to answer the what, the why, and the how about everybody that we're working with. In terms of leadership and management, this is seen and often referred to, and I suppose we're going back here to the golden thread, but I would say rather than the golden thread, this is the golden circle. Simon Sinek, who is he's described as a guru. I don't know what you have to do to be described as a guru, but that's how he's described. So he's described as a guru of leadership. He's written some global best-selling books. One is called Start With Why, and then there's another one called Find Your Why. And he talks about this golden circle where why sits in the middle of what and how. And he says, he talks about organizations, and you could go and look at that a little bit more. We don't need to go into it because we're a bit shorter of time today. But essentially, that is what every worker should know in relation to their practice. Every aspect of their workload, they should be able to go through the golden circle of what am I doing? Why am I doing it? How is that impacting on the family? We should know that with everything that we're working with. It's a very basic reflective framework. And from my perspective, I feel that social work has why at the very start. Why am I going on this visit? Why has this family been referred? The why is essential, and we should have that at the very start of our practice, but also at the heart of our practice. And if you think about serious case reviews and what we know is that when professional curiosity is missing, that's when things don't work well. And professional curiosity is all about the why. So this framework, this what, why, and how framework, if you don't take anything else from today, take that what, why, and how framework and use it constantly in supervision. Ask yourself at the end of a conversation, even if it's an informal conversation with a worker about what they're going to do, Ask that worker, can we just check out here? Are you clear what you're going to do, why you're going to do it, and how you're going to do it? Let's just check that out. Let's get into the practice of what, why, and how. Does everybody understand the what, why, and how of their practice? And that's a key aspect of good supervision. So because this is such an important framework, I do want us to feel like by the end of the session this morning, you can take away what reflective supervision is, why it's important, and how to work more towards that in your own practice. So I'm going to go back to some old theory in a way, Toni Morrison's integrated model of supervision, which I'm sure you're all familiar with. It sits in the vast majority of supervision policies, and I know when supervision policies are being reworked, it's still always looked at. I've broken this down, the functions of supervision, and I've put these into a grid because I feel like this grid can be helpful. I will make sure everybody gets all of these slides. So you will have the slides as well as today's session being recorded as well, but you will get this slide. But I've tried to break this down into the why, the how, and the what the worker should experience, I suppose. So why do we do supervision? We do supervision to ensure competent and accountable practice. We do supervision to encourage continuing professional development. We do supervision to offer personalised support and to engage the practitioner with the organisation. And then the functions of supervision, they're not why we do it, they are how we meet those whys. So the functions of supervision, there are 4. Firstly, supervision has a managerial function. And in many ways, if you like, that is the oversight part of supervision. The problem is that many supervision sessions just go into that function and they don't dig, they don't go further down as it should go all the way down the table. But managerial supervision means that the social worker should experience space in which to discuss their practice, to reach decisions with support, and to have a level, to feel there's a level of shared decision making with clearly agreed lines of accountability. The developmental function, which is also referred to as the educative or the formative function, that means the worker should experience the opportunity for reflective discussion to enable them to continue to learn and grow and develop their practice. The supportive function means that the worker should receive personalised support with the challenges of the role, particularly important at the moment with COVID challenges. It is important, though, to recognise that whilst we need to talk about the emotional context of practice, supervision isn't a counselling session and we can't move over into that. We've got to be boundaried around what supervision can provide. And then the 4th function of supervision, the mediation function, that means the worker should feel like their supervisor understands their role and can help them to mediate being a social worker and being an employee, professional and employment. It's that helping people to mediate those aspects of their career. Unfortunately, some supervisors feel like they can meet the functions of supervision by throwing in a question and then in their head ticking off that box. So some supervisors, everything in supervision is managerial, but they start it off by saying, how are you feeling? And then they think in their head, okay, I'll tick off, I've done the supportive function. Halfway through the session, or maybe at some point in the session, they'll say, is there any training you've done or any training you want to go on? And then they tick off in their head, developmental function. What I want to say to you now, and what I want you to take from this session is that's not enough. You don't ask a single question and tick off a function in your mind. Every worker that you work with needs to experience all 4 of those things. Now, what I would say, and this is a personal perspective, I would say it's very hard to do all 4 of those things in a single supervision session. But if you base it on what does the worker get and where do they get it from, as long as the worker gets all 4 of those things, where are they getting that from? So think about what you can provide in one-to-one supervision, but what you could equally provide in peer group sessions, or what can be provided in informal supervision. A lot of the case discussion takes place in informal supervision. And then what I find is people do formal supervision just to record that. So actually it ends up being very repetitive and it lacks development and support for reflection. So that's a little bit about the what of supervision. I'm going to go on to look at what about reflection. And to do this, I'm going to use 4 S's of reflection, which then come together in the 5th S of supervision. So we're going to look at the stages, the steps of reflection, the spaces of reflection, and the structures of reflection, or we'll go as far through those as we can in terms of the time that we're allowed this morning. So stages of reflection, a lot of people talk about 2 stages of reflection, and I know lots of training like I don't know, early years degrees as well as social work degrees will look at 2 stages of reflection, but actually there are 3 stages, and if we want to have full growth, as that illustration shows, we need all 3 of the stages, and this is really important. So I imagine that you are very familiar with the 2 stages of reflection that generally people talk about. This is reflection in action. This is what you do in the moment as something is going on. So this morning, when we started off and there were all the technological problems, reflecting in action meant the response is we can't fix this, so let's just move elsewhere. That's you reflecting in the moment. What can we do about this? How do we change things as they happen in the moment? Reflection on action is what you do later, looking back at a situation. So at 12 o'clock when we finish, I'll look back and think, what went well, what didn't go well, maybe what should I have done differently? Those kinds of questions. That's reflecting after the event. Quite a long time, that was written in 1983 in what's seen as a seminal text by Sean, who that wrote the book The Reflective Practitioner, How Professionals Think. That was all his work. Later, Killian and Todnam added a 3rd stage of reflection, and they called that reflection for action. So they used the same kind of terminology that Sean used because it had been so popular, but they went with reflecting for action. That's the reflection before a piece of work. So they said, is Mr. Stage here? Because he's talking about reflecting while it's happening and after it's happened. But what about reflecting before something's happened? In a way, reflection for action is almost your planning and preparation, but it goes beyond descriptive planning. Descriptive planning is, I'll do this and then I'll do that. Reflection for action is, but what if this happens? And what if that happens? It's having a clearly thought out, well prepared plan of action, if you like. So what we should end up with is a cycle of reflection. Good work with children and families, it doesn't matter what that work is, with children and families, good quality practice involves reflection at 3 stages: before, during, and after. Reflection for action, in action, on action. So almost like 3 stages: plan something, do it, then review it, and at all 3 of those stages reflect on what's happening. So that's reflection, the stages. Just one quick thing I would say to you is I feel as though reflection for action has been the missing component for quite a long time in children and families practice. Very often experienced workers will just go out and do something and almost not think about it, do it a bit on autopilot because we're so busy, because of lack of time. People will just do stuff almost without thought. The problem there is it actually ends up taking you more time and more work. But what I've noticed is that certainly, especially at the beginning stages of the pandemic, social workers have been reporting more reflection for action during the pandemic, certainly at the start, because it's challenged our routinized ways of working. We have to think of new ways. We have to do a COVID risk assessment before we can go out. All of those things mean that we're spending more time thinking ahead and reflecting for action, and that's important. So that's the stages of reflection. In terms of the steps of reflection, I'm going to do this very quickly. because I'm conscious of what we can cut this morning because of the time delay that we had in getting started. And there is a video on this that I can direct you to. So if you feel this is an important learning point for you, there's a 15-minute video I can direct you towards where I talk about it in more detail. But essentially, in social work and children's social care, we use the phrase reflective practice to cover 3 separate but connected components, 3 steps. And we should move through these 3 steps through the stages of our career. So we should begin with reflection, move on into critical reflection, and onwards to reflexivity. So in terms of what those 3 steps mean, very quickly, reflection is about thinking, constant thinking, actively, persistently. It's not just something that we do with hindsight. Critical reflection takes everything from reflection and then adds on a bit. Critical reflection adds on issues of power, the socio-political context, going into enough depth to create change. Critical reflection is often seen as it's what's required in studies. So when we're doing our degrees, when we're doing our qualifications, critical reflection is what's honed in on. That understanding at that level is critical reflection. And then reflexivity is where we should all be working towards. All of us should demonstrate reflexivity in our practice. And there's a lot to reflexivity, so I would encourage you to watch the video. But reflexivity originally comes from the world of research. And actually, that's what we're doing. As children and families practitioners, we are researchers because we're going out to look at, we're gathering information about a child's life or a young person's life. We're analysing that information to reach a decision and to make a recommendation. That's what researchers do. So reflexivity is what you should be doing in practice. What social care with children should be all about is reflexive practice. And essentially, reflexivity is about seeing the person in the context of their environment, understanding the connectivity. So things like contextual safeguarding. Anything that has an X in it, here's a hint for you. Any word that has an X in it is all about this. It's all about reflexivity. Contextual safeguarding is about understanding context, which comes from critical reflection, but then taking it into reflexivity, which is about understanding how the child's context and their environment connects with them and raises risks in different ways. So we have to understand issues of relationships, connectedness. That's what reflexivity is about. And, you know, we could do a whole session on, let's look at how can we improve our reflexive practice, because reflexivity is much more contemporary. It's what we should be talking about now. Essentially, reflexivity, the other thing that reflexivity does is it brings the centrality of self. It brings the self into things. So it's understanding what impact did I have on that family and what impact did that family have on me. It's that self-awareness. It's understanding why 2 workers can go and see the same family and come away with a completely different view. And it's because of who they are rather than who the family is. It's how we see things is because of who we are. So understanding all of that, that's reflexivity. So I've whizzed through that really quickly. We can revisit it, but I can direct you towards a video. But what we should all be doing is we really, rather than talking about reflective supervision, we should be talking about reflexive supervision with an X in, but that's an aim. It's what we should be aiming towards. So they're the steps of reflection. But what I want to really focus in on, and I don't want to cut the time that we've allowed for this, is the spaces of reflection. And I really wanted to talk to you about this because of the pandemic, what's going on, the way in which we're practicing at the moment. So I'm going to go through this and then I'm going to take a break from screen sharing for a moment. And if you want to put your camera on, that's fine. But I'm going to ask you if this has meaning for you. So I'll invite you to put your microphones on if you want to say something, but I really want to see whether this has meaning and resonance for you as practitioners and managers. So I've already said we take a child and environment perspective. We know about doing that. We know the importance of that because that's reflexivity. But we're going to look at the spaces. So where we see the child in the context of their family, their community, society. We need to see the worker in the context of their team, the organisation, society. We need to see contexts and relationships, and spaces is a key part of that. Over many years, I've asked people, where are you most likely to reflect? And this is what they've told me. They've said, the car. The car is always the number one space of reflection for child and family practitioners. The bathroom is another one that they tell me, and bed. Now, there's a couple of things to say there. One is they are largely personal spaces, not professional spaces. So in a way that kind of starts to suggest, well, is this something we do in our own time rather than this being a professional activity? I'd like to think that we'd say the space that we reflect the most is supervision, but that's not what people tell me. What they tell me is the car, the bathroom and bed. And that was way before the pandemic. You can see, look, the reference there, I wrote it up in 2018. Hundreds and hundreds of social workers telling me where they reflected. Another quick thing to say is I understand why people say bed. Sometimes when you get into bed at night, it's the first time you've had silence and stillness. So that might be why people reflect. But if you're waking up at 3 o'clock every morning thinking about work, that's not reflection. That's coming close to burnout. So that's, we just need to be conscious of that. At the beginning of the pandemic, Harry Ferguson, whose work I greatly admire, his work on child protection is exceptional, very practice-focused research. But at the start of the pandemic, he wrote a blog on research in practice, great blog, and it was talking about working at home and how children and family social workers working from home, he said, would need to find new thinking spaces. So he called it thinking spaces around what he describes as transitional spaces to enable continued reflection. And I think this is really, really important. This is about looking at the car. The reason people say they reflect in the car isn't because it's the car, it's because the car is what normally helps them to transition from one part of their job to another, move from one visit back to the office or drive home from the office. So they're transitioning from professional to whatever they are at home on the way home. That transitional space is what we've lost in the pandemic. And that has to be, we have to recognize that within supervision. Supervision needs to change because of the change in reflective spaces that are available to people. I want to really drill into the impact of working from home. I know lots of people used to really look forward to having a day at home. I used to love it. I used to say, I'll stick a wash load on at lunchtime, or I used to love a day at home. Now I can't wait to get out of home. It's that bit about it used to be seen as a treat and a luxury, and now it's seen as really limiting us and isolating us. We know trauma and space are connected. We know that as social workers, because we know that being trauma informed, we know that spaces can trigger memories of trauma. But even wider society knows that. So that phrase that gets used quite a lot, do you remember where you were when you heard such and such a thing? That's used quite a lot, isn't it, as a phrase? We're bringing social work into our homes, into our families, and we need to think about how do we avoid secondary trauma impacting on our families and loved ones. There's also working from home leads to limitations in terms of situated learning, how people learn from one another, and also situated support. When you're in a busy office, you learn because you overhear somebody dealing with a difficult telephone call and you think, oh, that was a really good way of doing that. I'll use that next time. Or if you've had a really difficult telephone call, you put the phone down, other people in the office know that was a difficult call and they'll come over and maybe make you a cup of tea, or they're there to chat to if you need them. That's gone if you're working at home. So that's situated support, that's situated learning when you're at home on your own is gone. And I believe quite strongly that our employers and our educators have a responsibility to support us in creating reflective and emotionally safe working spaces. So the final bit of reflection that I'm going to talk about is reflection with. I suppose this is about that lack of situated support, really. So this is something I was involved in writing about with Joe Finch and Prospero Teddem, two social work academics, and we use the phrase reflection with, and that's all about the importance of reflecting along with other people, bouncing your ideas off other people, even if it's just you reflecting, but there's people around you while you're doing that. Reflection with is really important, especially in social work. Sharing reflection with one another is vital in social work. But that's gone a bit. Now, if you want to add like Shern and go reflection with action, it still works, but it's, you know, because it's about adding action onto your reflection. But essentially, it's the with bit that matters. It's the being with others when we reflect. And this takes me to what I really want to introduce to you today around why reflective supervision at the moment is more important than it has ever been for social workers, for early help professionals, for everybody. And that's because of this concept that was new to me at the start of the pandemic, and it's the concept of moral injury. Now, moral injury is something I'd never heard of before the pandemic, but having researched it, it comes from the military. That's where it's taken from. And in the military, moral injury is used as a phrase to refer to the psychological distress that occurs when people have to take an action that violates their moral code, or when they can't do something and that violates their moral code. Now, the word moral code, that comes from the military, where this is taken from originally. I think we would say ethics rather than morals. So this is all about when we do something or we're not able to do something and that violates our ethics. So much that I thought about, should I rename this? Should I talk about an ethical injury? But moral injury is something that is widely talked about in other professional groups. It's just new to us in social work. So I thought, no, we'll keep it as moral injury because it helps us to keep connected with other professions. So it's separate to, in the military, they talk about post-traumatic stress disorder and moral injury as two separate things. People who develop moral injuries, the military say, are likely to experience negative thoughts about themselves or about other people. And feelings of shame, guilt, or disgust are very common amongst people who experience moral injury. Now, moral injury, in many ways, is similar to stuff we already know about in social work. And we talk about like stress and burnout, like vicarious trauma, like compassion fatigue. We talk about those things in social work. But you wouldn't expect those to hit people early in their career. They're normally things you would be looking out for when somebody's been a social worker for a long time or a helping professional for a long time. But actually, moral injury is something that people are experiencing from day one. So students on placement are experiencing moral injury. It's happening all of the time. So I read this article, the reference there, Greenberg et al., at the beginning of the pandemic. It was written by some doctors in February. And they were talking about what they thought was going to happen during the pandemic. And they said healthcare professionals, they felt, were going to be at risk of significant moral injury because of three things. And this is their wording. So this is from the British Medical Journal. They said because healthcare professionals were going to have to think about how to allocate scant resources to equally needy patients, their words, not mine, because they were going to have to think about how to balance their own physical and healthcare needs with those of their patients, because they would need to make decisions about how to align their own duty of care towards their patients with their duty of care towards their family and their support networks. And when I read that, I was really captured by it because I thought social workers do that all the time. We don't have to have a pandemic to be thinking about how do we allocate scant resources. We don't have to have a pandemic to think about our own self-care and how that can sometimes end up being in conflict. We don't need a pandemic to be thinking about this, but this is really happening at the moment. And I'm just going to give you two examples of moral injury. I started to talk about this and people are contacting me literally every day. I'm getting messages from people talking about their examples of moral injury. So I'm just going to give you two. I'm going to tell you, one's a student, and this is a student who It's an easy one to identify with, which is why I'm going to use this. And I've got permission to share these examples. So this is a student sitting at her kitchen table on placement, working from home. Her children were playing out in the garden. She was on a really important telephone call. It was a pivotal moment of a safeguarding conversation. And to add another layer, she was being observed by her practice educator doing this via Teams. And her son fell over in the garden and he started to cry. And the mum in her thought, I want to run outside, pick him up, kiss his knee better. The social worker in her thought, I need to be with this mum on this telephone call because this is a real pivotal moment in our relationship and the conversation about safeguarding her children. And the student in her thought, I've got to pass this direct observation. So she felt pulled in that moment in lots of different directions. And whichever decision she made, she felt she would have experienced shame or guilt. Or so there's an example of a moral injury. And that example is that experience has stayed with her. And most people can identify with that. But another one that relates to supervision, because I know this is about supervision today. This is of a supervisor who was doing a supervision session with a social worker on Teams. It's going well. The social worker was sitting in a bedroom. Supervision's going well. And all of a sudden, the door opens in the background and a man comes in wearing a towel. And, you know, this is the supervisor was thinking, oh, gosh, you know, sort of sitting quietly. And the man starts shouting, and he really starts shouting at the social worker. And she says, please go, I'm in a meeting. So he leaves. But then he comes back in again moments later and he starts to throw things at the social worker and he starts to scream at the social worker. And this is an example of domestic violence taking place in a supervision session in front of the supervisor's eyes. And that's a real example there of moral injury on so many levels from so many different directions. So the fact that we've taken social work into our own homes is really impacting and is going to throw up more of these kinds of dilemmas that both need to be discussed in supervision, but will also take place in supervision. So because this really interested me at the beginning of the pandemic, I started researching around it. There's very little written about this in terms of social work. There's a few articles in America, but not very much at all. But what I did find, looking at all other professional groups, research around the factors that might mitigate the impact of the injury. And this is what it says, mitigates the impact of moral injury. Team working and a strong community of practice and a sense that you belong and are connected with your team and that community of practice. A strong reflective culture. Good quality, emotionally supportive and reflective supervision. The opportunity for in-depth reflection with a particular focus on feelings and emotions. Education about the potential of moral injury and the opportunity to talk about and explore the depth of the injury with colleagues. And a clear recognition of the importance of your role and value being placed upon that. Now, other than the clear recognition of our role, which I think we're always going to be missing really, and isn't almost within our gift to give, if you like, although managers can make sure workers feel valued by them, by society, I think we're not really always going to be valued. But other than that, the good news is that this is all stuff we can do. This all relates into reflection, supervision, what we can do to help people keep connected. So I was involved at the beginning of the lockdown period in March in developing a new model for group supervision, reflective group supervision, that would specifically address the impact of moral injury. And we're going to do that. There's 2 groups going to experience one of those sessions this afternoon, so that you get to see how those sessions work, and you could then maybe start to facilitate those in your own teams. But specifically addressing those, I developed a new model for group supervision. At this point, though, I'm going to stop screen sharing because I just want to talk to you about whether this concept of moral injury is something that you're familiar with. Is it something you've heard before, or is it something that's kind of, the phrase is new to you, even if the idea of it isn't new to you? And how are you feeling all of those things? What is happening for you with this? So I'm going to stop screen sharing. I'm going to see what your thoughts are about this. Feel free, you don't have to switch your camera on, but feel free to do so if you want to. But you can pop your microphone on if you want to just say, did that ring true for you? You tell me. Got total silence now. I'd just like to hear from somebody.
I've just taken my microphone off, Siobhan. It's Sarah. Hi. Yeah, I think that's that moral injury was really, really interesting, and thinking about I think Eloise put on the chat there really good sort of real life examples, and it's something I think that will resonate with everybody on this training, that we do come across things. We're all so busy at the minute. We're trying to do, you know, the jobs of 2 or 3 people. It's a pandemic. We're even busier than normal, and I think you do think. I think you reflect a lot, and you reflect a lot on the negatives, not necessarily on the positives. It's very self-critical and thinking, you know, what have I done there? How could I have done that better? I've made a mistake. You know, what's going to happen now as an impact of that? So it's really interesting to see that moral injury is actually a piece of research that, you know, it does affect a lot of people.
I think it's almost helpful. It's, in a way, it's not telling us something we don't know, because we know that's occurring, but it gives us a phrase. And I think in a way, it almost just gives permission for people to talk about it, you know, maybe raising this with a team and saying, and this isn't just something that social workers are experiencing or that just early help professionals are experiencing. This is something that all helping professionals are experiencing at the moment, and something that we maybe just need to talk about and be there to support one another. Because we've got to look at how we support people in different ways, I think, haven't we? Because the usual ways aren't there. Just, you know, even things like when people have an abusive telephone call, let's say somebody's shouting at you on the phone, that can be difficult to deal with. And I know particularly early in somebody's career, sometimes they do take that personally, but I think we get used to it more and we're able to deal with it and know how to deal with that. But when you're doing that in your own house and somebody's shouting at you and you're sitting in your own bedroom, it's very different, and it feels very different. Lots of things that people are ordinarily very resilient to, very used to, are actually much changed, you know, and much more difficult to deal with. And supervisors really need to be able to explore that with people, and I think give permission for that. Are there any other thoughts? Sarah's shared something there. What about other people? Anything else from other people? Is there nothing else?
I was just going to say, I think it's very difficult when your manager's not actually social work trained or a person's people, and if your background's social work and you're not actually being given what you need, and because of the pandemic you can't go seek it from other alternatives, if you like, that's difficult.
Yes, I agree. I'm not sure who that was, and if you don't want to say, you don't have to say who it was. You can leave it as an anonymous comment if you like, but I do agree with you. I think that's a real issue, and something that is interesting to me is very, very clearly laid out in the adult social care supervisor standard, that if you've got a social worker who is managed by a non-social worker, that they must be given professional supervision by a social worker. But that same thing isn't laid out as clearly in the children's supervision standards, which is very interesting. Just thinking about that lack of, so in a way, it goes back to those functions of supervision. If your supervisor isn't a social worker, can they do all of those functions of supervision? And it's unlikely. So really, someone from a professional background should receive some supervision. If not, they don't need all of their supervision, but some supervision from someone from the same professional background. And I think that's really very relevant. And I also agree with what's been put into the chat. You know, also managers can be so busy that what they regard as periphery issues can go by the wayside. And I do think that's true. And, you know, I think there is so much on for us at the moment that just trying to think about where should our priorities lie and all of that is really difficult. And that's why I wanted to raise with you the concept of moral injury. And I suppose in a way it relates to the spaces of reflection and the changed spaces of reflection during the pandemic. But it also answers the question, why should we provide reflective supervision? Because that's one of the whys, isn't it? So as well as it fits in with the S's, as I said to you, we're going to structure things around the S's, but it also helps answer the what, the why, and the how. Why is this so important? And you're quite right that this can be really difficult, and managers having the emotional resilience themselves, absolutely, it's really difficult for managers, and managers are also dealing with trauma and hearing trauma and secondary trauma on so many layers, so many times, often in their own home. And that was a comment in the chat about managers' own resilience. So what I'm going to try and do is I'm going to just introduce for you very quickly a model of doing reflective group supervision that really was designed to address the potential impact of moral injury. And it's a very simple model, but a very different way to provide group supervision, which was developed just for the pandemic. So it's all about contemporary working practice, if you like. So I'm going to share that with you now. So I'm going to go back to screen share, and I can see Sarah again. Sarah, can you see the screen share? Can you just nod at me? Okay. Yeah, fabulous. So what I'm going to just do is quickly introduce for you the University of Chester Reflective Connections model. So I'm a visiting professor at the University of Chester. At the beginning of lockdown, all of my training was cancelled because nobody wanted training when everybody was just locked down at the beginning. So I did quite a lot more work with the university in that role. And we were approached by the principal social worker of Cheshire West and Chester, and they know, they've given permission for them to be named in this, because they were looking at trying to get support for their social workers in helping social workers to think about resilience. And it was all about people working from home and people not being connected together. And this is all very remote. I mean, a lot of people are talking about virtual working. I'd say it's not virtual, because virtual indicates something that's not quite real. And this is very real for us, but it's remote, so whatever it is, it's remote. And we recognised how important critical reflection is, because, that's my area. It's what I'm really passionate about. So we offered to facilitate some group reflective sessions, and we just did a pilot of 3 sessions to start with, thinking that what we were doing was a kind of second best, and it was the best we could offer at the time. But actually the feedback has been so positive. It works so well. You can adapt it in so many different ways. But we then extended it out. Every team in that local area had a session facilitated by us, and now they all facilitate their own sessions in this, and it is working really well. What we do is, instead of in an ordinary group supervision session, if you have them in your teams, what ordinarily happens is one person each session will bring something, and they will talk about maybe a piece of work they're doing or a struggle they've got, and everybody will chip in and maybe give some questions or some thoughts or some comments, but it's really about one person reflecting in depth. We swapped that around completely, and although it's a very simple model, it's actually very powerful. So what happens is, and this is what's going to happen this afternoon if you're one of the people who's coming back at either 1 o'clock or 3 o'clock. So initially this afternoon, everyone will introduce themselves, and I'll explain how the session's going to run. And then each person is going to present something for 5 minutes. Everybody is going to talk about something that they've been involved in during the pandemic. So this is speaking to those of you who are coming back this afternoon. If you're coming back this afternoon, you need to be ready to talk for 5 minutes about something during the pandemic, whether that's a problem that you've experienced, whether it's a specific supervision session that you've had that you want to reflect on, or whether it's just how things have gone for you. So, but everybody needs to present something. And I'll be there, I'll listen to each person's presentation, and then at the end I feed back any connections that I've noticed. At the end of the session today, I'll give you a bit more information about how to prepare to come back. But it's that connection bit that is the valuable part of this session. So the fact that everybody comes and everybody shares something for 5 minutes, it's like the microphone is theirs for 5 minutes. No one else is going to say anything, ask anything. what we're finding and the feedback we're getting from team managers is people who are ordinarily really quiet are actually engaging in this and are getting a lot from it. It's opening things up for discussion that people haven't been sharing before. And it's an hour, hour and a half, depending on the size of your team. So I do sessions normally for 10 people for about an hour and a half. They sometimes go to about an hour and 40 minutes, something like that. But we give people a very specific thing we want them to reflect on. And we also give them a specific structure. So if you're coming back at either 1 o'clock or 3 o'clock, I'm going to ask you to reflect on something that's been going on for you during the pandemic. But I'm going to ask you to use one of these 2 models to share back with the team. So you will structure, if you like, your 5 minutes around either head, heart, hands and feet, or surprises, satisfactions, dissatisfactions, learning. So you can use either of those to present your reflection this afternoon. Now that's a beginning of reflective connections, but I've been delivering these loads, or I do a couple a week and I deliver them in terms of training, but I also am helping people to facilitate them. But then once you've facilitated 1 or 2, you then want to mix it up a bit. So you then give people a different task and a different model. So I worked with a group of 5 students through the whole pandemic on placement, and I did a group supervision session with them every week. Every single week of their placement, we did one of these connection sessions. So each week they came with something to reflect on. So they each spoke for 5 or 10 minutes. And I gave them a different thing to reflect on each time. So you can do that. You can, for the students, I've got them at the beginning, they reflected on their induction, and I gave them a different model of reflection to use. For their later on, I got them to reflect on a piece of casework. At another point, I got them to reflect on what else did I get them to reflect on? I got them to reflect on their midpoint. I got them to reflect on what their learning needs were. I got them to reflect on a challenge of multi-agency working. So I gave them a different topic, if you like, for each week, but also a different model of reflection. Now, I know in Wakefield, loads of you have got reflective practice prompt cards because you were given a set of cards, supervisors were, I know. So these are prompt cards. So these are 2 of the cards. It's very easy. It won't take you a lot of time as a supervisor to prepare for these, because you literally pick out a different card each week and say, that's the card we're going to use to structure our reflection this week. And this is the topic. So you could do it every couple of weeks or however often you want to do it. And then they take turns in doing the connector role. So I'll do the connector role today. It means listening carefully, and it means feeding back at the end what connects everybody's reflections together. But eventually you get the team members to do the connector role. Now, this is so good on so many levels. Firstly, it meets so many of the functions of supervision, but in a group session. So you might get all those functions of supervision done for 8 staff in one hour and a half session. So it's great to do that. It's really supportive in terms of moral injury. It brings teams together. The feedback from them has been brilliant. But the other thing is, if they're social workers, this is the best evidence for CPD, Social Work England, because they prepare for the session. So they've made a few notes, so that can go on to their CPD. Then the notes that are made of the session, and I'll show you how I make reflective connections notes as well, if you attend one of the sessions this afternoon, that can then be uploaded to their Social Work England. And it ticks so many boxes because they're reflecting on their practice, they're using supervision, it ticks so many of the CPD requirements. It is a fabulous tool to use as a supervisor. But it doesn't have to be the supervisor that does this. Anybody on the team can facilitate one of these sessions, and they are very, very powerful. So two groups this afternoon are going to experience it. There's going to be 2 groups of 10. If you've got a link for this afternoon. It won't matter this afternoon. Oh, I don't know. Maybe we'll have to have a chat about whether we use the other session or come back into this Zoom, because we know this Zoom is working, but there's no screen sharing, there's none of that, so it's just very easy. We just come together in a group. So that's the reflective connections model. The key thing is it's about how everybody connects together. And there's a lot of text on this slide, so I'm not going to read it all out, but the slides are going to come to you, so you will see it. But I've done quite a lot of work internationally. I was fortunate to be the secretary of the International Federation of Social Workers for a while. And I've done quite a lot of work with the United Nations about supervision and requirements for supervision. Now, they wrote really good guidance on supervision for staff using for staff who work in substance misuse services, but it's great guidance. And they say that each worker should experience 4 things. They say, and to me, in a way, it goes back to the 4 functions of supervision, although that's not what they mention. But they say every worker should experience supervision and case discussions, which is like your informal conversations, team meetings, but also intervision. Now, intervision is the thing that's very new to us in English social work. It's used in other social work all over the world. They have intervision sessions. It's used in other professions in this country. It's used in healthcare settings a lot, and it's used in some education settings, in some education authorities. But effectively, if supervision, go back to the beginning of what supervision was, if supervision is oversight, overseeing, intervision is between seeing. It's all about peer conversations and peer working on what you're doing. So things like in social work, if you're familiar with things like the Hackney model, that kind of is based around intervision discussions, hub group discussions, team discussions, those kinds of things. The reflective connections model is an example of intervision. And if you're wanting to look at this, you can go and look at it in a bit more detail, and we can talk about it later if people want that. But basically, intervision is seen as the best way to provide emotional support for people because it's of peer groups. So particularly during the pandemic, it's something we should be looking at. How do we provide emotional support through a supervision forum, if you like, and that's intervision. So we've looked a little bit at, that's one method, one way, reflective connections. But the final bit I want to look at with you, the final S, is about how do we structure reflection? And I suppose in a way, therefore, how do we structure supervision? We need to structure reflection using different models of reflection. And the key thing that I want you to be able to take away from this conversation is to be able to identify the difference between a process model of reflection and a component model of reflection. And what you need to be aware of is that different models of reflection, or different structures, different ways of structuring the session, different ways of structuring reflection, work for different people. So you have to be familiar with a wide range of different structures. Process models, you can have component models, or you can have self-created models. Get your team to develop their own model of reflection. It's phenomenal. It's a brilliant way of getting your team to think about what they need to reflect on. But there's a whole other session, I suppose, about that. Although there is a webinar if you wanted to watch it on how to get that done. What I do think, though, is as a profession, we really must recognise where the models we use come from. They are very Eurocentric, they're very gendered, you know, they're all pretty much all of the models of reflection that get used in supervision in this country are written by white middle-class academic men. That's where they come from. And that doesn't reflect who we're working with as social workers. So I'd encourage you to, and I'm just reminding you here of the social graces. Think about the social graces of your team. If you're not familiar with this, this is something from, it's used a lot in reflexivity. So it's a way of thinking about and understanding ourselves and our intersectionality of identity. But basically, it's looking at what's your identity as an individual, and you could work around the graces and identify yourself in relation to each of those graces. If you're a manager and you're supervising a group of staff, you've got to be conscious of what your graces are, who are you, but also who are your staff and how are you connecting with your staff? And are you using a model that doesn't work for that member of staff because of who that member of staff is and how they think and how they see things? So we need to be much more individualized in our choices around the use of supervision and of models of reflection. So all of the models of reflection nearly all come from single areas of the single graces. As I said, they're all written by men. They're all very white, very Eurocentric. That means that those models are not necessarily going to work well for everybody, which is why we need to think about having a variety of different models. There is research that says people reflect and think differently based on aspects of their social graces. There's also quite a lot of new research on neuroscience that is related to how we can get people to develop their analytical thinking and their ability to write analytical assessments. And again, that's a whole other area we could look at. But all of these things I'm suggesting to you are all about enabling skills around reflection and analysis in social work. So what you really need to be conscious of is a process model or a component model. Some of the staff you work with will work really well with process models of reflection, and others, it just won't work for them, and you'll need to use a component model of reflection. You need to identify which model of reflection works for you and what works for the staff that you're with. And the model that you find works for reflection might not work for that staff member, and you're then thinking they can't reflect. Actually, it's just that model. That one model doesn't work for them. So the difference between a process model and a component model, I've tried to kind of illustrate it with those two little diagrams on the screen. One thing is, one way you can tell that something's a process model is it gives you a set of stages to go through, steps to follow. See, like it's got 1, 2, 3, 4, 5, 6 there. A process model says do this, then do this, then do this. But the other way you know something is a process model is a process model can only be used to reflect on action in hindsight. So it takes us back to the stages of reflection right from the beginning of this presentation. If you remember the stages of reflection, a process model is designed to help people to look back at something. My view is, as a supervisor, why wait till something's happened and get them to look back, because a mistake might have already been made at this point. Why not spend more reflective time in supervision, reflecting ahead, thinking about what we could be doing and how we might do it? And that's not a process model. A component model can be used at any stage of reflection. It can be used to help you to plan, to think ahead, to reflect in action. And the components can be considered in any order. There's no stages. There's no do this, then do that, then do that. They're much more flexible. The problem is that component models can leave people feeling a bit less confident about what to do, because a process model says, do this, answer this question, now there's this question. It kind of gives you a series of questions. So supervisors feel quite confident with process models, and often workers feel quite confident with process models. We can feel less confident with a component model, but I would say using component models in supervision can be transformational on a range of levels. It enables improved analytical skills in staff. It usually enhances practice, enhances reflection. I think moving to a component model can work wonders. And they're not taught very much on social work training. And the reason for that, people will say to me, why don't they teach component models? And that's only in this country, by the way. If you go to other countries, they totally teach component models, and they're highly critical of British social work being very process model led. But the reason they focus on process models is because training is all assessed through you writing an essay looking back at what you've done. So they're going to teach you a model to help you to look back, whereas practice should be more about looking forwards. But then they're not focused on that. They're looking back, always looking back rather than looking forwards. So I'm going to give you 2 examples of process models, and then I'm going to throw in a component model just to give you a bit of a flavour. But if you've got the reflective practice prompt cards, you've got loads of different structures of reflection on there. This is the most commonly taught model of reflection. Everybody is familiar with this. I've given you the original date, 1988, to show you that process models tend to have been around for a long time. And in a way, for me, I see them as a bit old-fashioned, actually. They definitely don't seem to sit well with pandemic practice. I know that. So they are old models, process models. But this is Gibbs. Now, Gibbs starts off, it's 6 stages. So a lot of people will look at that and say, oh, that's why it's a process model. And it is a very obvious process model, this one. But it's not just because it has 6 stages that you can tell it's a process model. It's also because it starts off with describe what happened. So it's designed to wait till something's happened. So it works through a series of questions around what's happened, what were you feeling, what were you thinking. Then you evaluate what went well, what didn't go well. You analyze, which would be things like what theories have you used, what legislation have you used, how does that link with this, how do you understand it? That's your analysis. Conclusion, what have you learned? Action planning, what will you do differently next time? Now that is a very, very standard way of reflecting. And in the past, certainly in the 1990s and the early 2000s on social work education, they literally would read that out to you and say, that's reflection. But it's not. It's only one model of reflection. It's just one way of reflecting. And it's very Eurocentric and it's very male and it's one way of looking at reflection. It works for some people, but it doesn't work for everybody. And the other thing I'd say is, especially in supervision, if you're using the same kind of questions all the time, it stops being reflective because people get used to what you're going to ask them next. It's no longer reflective. It's just, oh, and now I'll say this, now I'll say that. So you have to mix your models up a little bit. But that's seen as a very standard, used a lot model. And if you want to use that, that's okay. I mean, I am highly critical of it. It doesn't mean I don't use it, because I do use it sometimes. But I would say I'm quite happy for people to use it. That's fine. But don't just use that one. Use other models as well. That's my plea, really. So that's one process model. And here's another one, Borton, 1970. Now, some people will refer to this as Driscoll et al. Or Rolfe et al. And give you a more recent reference. But I think it's worth going right back to the original. And this is, 50 years old this year. It's an old model. It's not taught a lot, if I'm honest, this one, on social work training, because it's seen as overly simplistic. But the reason I've brought this as an example for this morning's session is because this one is seen as very useful in supervision. It's a good model for supervision. So it's used quite a lot in supervision training. This is the kind of model that you teach supervisors because it's seen as helping people move on from a situation. So if you've got someone who's a bit of a storyteller and just tells you what's been happening, but you don't get any understanding of the way they understand what that means, but they just describe to you and they just keep on telling you the story over and over again, this is a good way of moving them out of that into what needs to happen. It's another process model. You can tell it's a process model, two reasons. One, it's got 3 stages, step 1, step 2, step 3, what, so what, now what. But largely the easiest way is because it looks back, because it starts off with, well, what happened, what went on? So you know that it's a process model. So I've given you there 2 examples of 2 different models of reflection that you could use in supervision. I suppose the structures, that's what we're talking about now, the S is structures. This is all about what are you going to ask in supervision? What kind of questions do you ask? Where do you take the conversation? How do you structure your conversations? And you use a model to help you to structure conversations. So they're both process models. If you use those, you're taking someone through a reflective process. They're both good models for looking at a single incident that's occurred. Then you've got a component model example. This is an example of a component model. This is probably one of my favorite component models. There's a few that I like to use. I like the Big 6. That's quite a popular one, but I thought I'd go through this one with you today. This is Corthagen's reflective onion. Now, Corthagen says reflection is like an onion. You can peel back the layers of the onion, and as you peel back the layers, you see another layer. Each layer you peel back gives you another layer that you need to consider and think about. This is a component model. It's a component model for two reasons. One, it doesn't say you have to think about these components in any order. You can do it in any order you like. As long as you think about those 6 things, it doesn't matter what order you think about them in. But sometimes people still can't see that because they'll still think environment is number 1, behavior is number 2. So they still put a process into it. So the easiest way is to recognize that basically a component model says, think about this stuff. In a very non-academic way, it just says, think about this stuff. And you can think about this stuff before something happens. So I was involved in a supervision discussion a while ago, before the pandemic, where a social worker and a family support worker, and we were in a session together, and they were going to be removing a baby from hospital. It was a newborn baby removal. We know that's a really difficult piece of work. You don't wait till that's happened to reflect on it. You need to reflect on it before. So we used the onion to think about that piece of work. So we thought about, what do you know about the environment? Even down to practical things like, is mum in a room on her own, or is she on the main hospital ward? So where is the removal going to take place? Even down to practical things like that, but also just the wider environmental issues, like, how are the midwives going to receive you when you go in there? What do you think it's going to be like being a social worker going on to a maternity ward? Those kinds of things. Behaviour. How do you think mum's going to behave? How are the midwives going to behave? What will you do if this happens? How are you going to behave? What are you going to say at this point? How are they going to behave? It's really, you just use the layer of the onion to prompt your thinking. And your thinking can be prompted before, during, or after. So you get the idea. But this, I should have put the date on here, I realise now, to show you, this is from the 2000s. So it's a much more recent model. Component models are more recent. But the key thing about this is taken from social pedagogy, which is a form of social work with children and families in Scandinavia. And you know that because it starts off with the environment. So it sees the child in the context of their environment, and it goes down into your mission. So if the onion had a core, that would be the core. And the mission is, why are you doing this? Why are you going? What's your aim? What's your mission in working with this family? So it's a really good model. It brings out lots of strength, and it really prompts conversation in a much better way than something like Gibbs does. So I'm trying to give you structures here for your conversations in supervision. Try and open things up differently. But another S that I would suggest, and this isn't really, I suppose, a model. This is more, we're going to go into looking at some questioning methods. What kinds of questions can you ask in supervision that are kind of really good, prompting, reflective questions in supervision? And solution-focused supervision is what you should be aiming for. Supervision should not be a space where a worker comes, throws all the information at you, and then sits and says, what should I do? That is not what supervision should be. It's what poor supervision ends up being, but it's not what supervision should be. What we should be aiming for is the worker finding their own solutions. But you might need to talk them through that. You might need to ask them questions that help them to discover their vision for this piece of work. But the key thing is, you take a not knowing position. If you take a, I know the answer to this and this is what you need to do, that worker is never going to develop. They're never going to grow. All they're going to do is learn how to do what they're told to do. So we have to start from a not knowing position so that we sit in a place where the worker brings stuff and we give them feedback. We stay curious, we stay interested in what they're saying, but we get them to find their solutions. And so for me, the most important thing is that good supervision is about skilled questioning. And so I've said to you that we're going to use the S's. So I'm going to use 2 final S's for the questions. One is Socratic questioning, which is a bit more complex. It's an academic phrase, but solution-focused questions. Now, I think you'll all be familiar with solution-focused questions anyway, but what I've done is I've broken down solution-focused questions as the GEMS questions, which I know is something you'll be familiar with. Solution-focused questions is GEMS. You ask goal-setting questions, exception-finding questions, miracle questions, or scaling questions, and that gives you your gem of a question. Now, I've done some slides, and because of the time, I'm not going to go through each slide with you, but you're going to have the slides. I've done some slides breaking down what each of those question types is. So, and I've given you some examples of the kinds of what I would call my gem of a question that I would ask in supervision. So if you're going to ask a goal setting question, that's all about helping someone to identify their goals. And if you just reflect, how many times do you ask these kinds of questions in supervision? How many times do you ask people, well, what's your aim for this piece of work? What outcome are you looking for here? How many times do you say to somebody, what do you want from this supervision session? What do you want to know by the end of this discussion that you don't know now? How many times do we ask those kinds of questions of people? Then we've got exception finding questions, and these are questions that help the person to see that they've got the resources to deal with this themselves. The thing is, these questions are great, GEMS questions are great to link into motivational interviewing, to do what we should be doing with families anyway. So you should really in supervision be modeling the model. You should be asking the kinds of questions that you want the social workers to ask families. If you want social workers to move away from just simply asking information-based questions and to help families to create change and to be motivational, they need to learn about this kind of questioning. And they'll know what kind of question prompted their thinking in supervision, so they'll know what kind of question prompts thinking. So exception finding questions help the person to see that they can solve this themselves. So, you know, you might say to a worker, well, when you have felt confident about doing something with this family, what was different then? Or you might say, of all the things you've done to improve this situation, which one's been the most effective? So asking these kinds of questions to help them find the exception to their own rule. And then we've got miracle questions, which is about envisaging answers. So this is really about getting your vision. So, the standard ones, if I had a magic wand, is a very standard one, but the one I love and I use a lot in children and family supervision. Imagine you could go 20 years into the future. What do you want that child to remember about social work involvement in their life? That question really prompts people to think about what are they doing and why are they doing it, and how is it going to impact on the child? This stuff is really important stuff to get people to be more analytical and less descriptive and less, here's all the stuff, tell me what to do. So that's an example of miracle questions. And then the final type of question is a scaling question. Now, we're very used to using these in social work, so we'll ask a scale. So I might say to someone in supervision, if they say they're concerned about something, I might say, well, on a scale of 1 to 5, how concerned are you? Or let's go back to confidence. So someone might say, I'm not at all confident about doing that. So I might say, okay, on a scale of 1 to 5, 1 is not at all confident, 5 is very confident. Where do you sit? Some people use a 1 to 10 scale. I tend to go 1 to 5 because I like a smaller scale, but you can go with whatever you want to. If they say to me, I'm a 2, I'd say, well, what would it take to move you to a 3 or a 4? The most important aspect of a scaling question is it must have a tail. So a scale and tail. A scaling question is no good without a tail. If you just say to somebody, on a scale of 1 to 5, how confident are you? They say a 2, you go, okay. That's not a solution focused question. That's just gathered information from them. If you then say, okay, so what would it take to move you to a 3 or a 4? That's a solution focused question. So I've tried to give you some examples of the kinds of questions you should be asking in supervision, not what have you done? Have you done this? These are the kinds of questions that prompt reflective, thoughtful supervision. And then in terms of Socratic questions is really all about just using a range of different questions. And I've done a slide here. I'm not going to go through them all. You can ask awareness raising questions, expansive questions, clarifying questions, tailed questions. Think about the kinds of questions that you ask. Socratic questioning is, Socrates was a philosopher, and he based his philosophy by engaging people in questions to test out what they knew, what they assumed, and to really extend their thinking beyond that, to use questions that probe someone's understanding and prompt their learning. And that's really what Socratic questioning is. Socratic questioning is asking probing questions. I would ask you to think about, if you were a fly on the wall in your supervision, how many different kinds of questions are being asked? Or are you simply asking information-based questions? Are you just saying to people, what have you done there? What's happening here? Do you go beyond the worker to try and find out loads of information about the family? Or do you sit with the worker and try and get them to understand and them to think it through and have a shared decision making? Because that's what we should be doing. So don't ask loads of questions about the scenario. Ask questions of the worker, and just take a fly on a wall thought about what kinds of questions are you asking. So I'm hoping that these PowerPoint slides give you, if you like, a bit of a resource pack on the kinds of structures you might use to structure your conversation, but also the kinds of questions that you might ask that keep people in that either solution focused structure or Socratic questioning to prompt and probe their learning. So I've whizzed through a few things because of our technological issues this morning, and I'm hoping I've still been able to give you the things that you were needing to get from today. But what I will do is I'll send Eloise a set of information about some YouTube resources that you could go and watch that I've done on reflective structures, for example, and on reflective supervision, that if you wanted to follow up on today, you could watch those. But what I want to do is I want to share with you my top tip for supervision. And this is my top tip, both for supervision and for what I want you to do. So, you know, when you end a reflective supervision session, what happens is it gets it's a bit messy at the end. It kind of peters out sometimes. So you'll do any other business, when are we seeing each other again? And then it kind of goes a bit into, are we done then? So I still do that. I still do any other business, when are we seeing each other again? But then in every session, I go on to concluding reflections. And I think it's really important to have a clear ending to supervision. It promotes continued reflection all of the time. Now, some people use a different method every supervision session. Some managers I know have a different method, like their reflection of the week method. So it depends on when you have supervision, which method you have. I use the same method to end every supervision session. And the reason I do that is because most of my supervision is with students. And if you use the same method, it helps you to look back at the whole placement and their answers to those each session, and you see growth and progress. But I would say, even as a manager, I would use the same session each month in supervision. And then when I'm coming to an annual appraisal, I would go back and look at the conclusion to supervision each month, because it gives you growth and progress and it evidences your annual appraisal. And the method that I use, so this is, if you like, my top tip, because it sounds simple, but it is really transforming in terms of giving you that evidence of growth and development, is I end every supervision with these words: surprises, satisfactions, dissatisfactions, learning. Now, that's one of the methods we're going to have on offer for this afternoon's session, because it's such a useful one. But I'm going to ask all of you now, whether you're coming back this afternoon or not, to take a couple of minutes to think about the session that we've just had and to just go through it. There's no question, it's just the word. If you were to think about what we've done together this morning and you were to go surprises, what's the first thing that comes to your mind? Now, I know the first thing that comes to my mind about this morning around surprises, but what's the first thing that comes to your mind? Then if I say satisfactions, what's the first thing that comes to your mind when you think about this morning? And then I say dissatisfactions and then say learning. What that does is it's seen as, it's a specific method to end an activity in a reflective way. That's what it was designed for. Every method of reflection is designed for something different. And this one was designed as a concluding reflection. It's to help you to reflect on something at the end, and that's why it's a really good way of concluding supervision. So that's my top tip. For people who are coming back this afternoon, I just want to take you on to the final little bit about what I want you to do. You have to do some work to prepare for this afternoon. You're either coming back at 1 o'clock or at 3 o'clock. We'll decide in a minute quickly with Eloise whether you're going to use the MyZoom or the original one. But what we're going to do this afternoon is have a reflective connections session where you're going to reflect on your practice, and I'm going to do some connections together. There's no real ground rules. We're all living at work, really, aren't we now? So, you know, if the doorbell rings or something, it's fine. If something happens at home, deal with it. That's fine. The only thing I'd say is think about confidentiality. Don't name people or places when you're sharing. But each of you is going to come this afternoon ready to present something. Now, it could be a piece of work that you've undertaken. It might be a specific challenge that you've faced. It might just be something you've been thinking about recently. It's entirely up to you. How you identify what you're going to talk about, entirely up to you. And I'm happy for as many different things as possible. And that's one of the joys of this, is everybody does something different. Then you're going to spend some time preparing. So the first thing you do is, this is what I'm going to talk about. And then you use either head, heart, hands, feet. You can use the questions that are on that screen if you want to, but you don't have to. You could do it in any order you want to. You could start with the heart, or you could start with the feet. The feet might mean something different to you. I used this model recently, and I used the feet to kick myself about something, because there's something that I did that, oh, I shouldn't have done that. And for me, I said the feet was I could have kicked myself at that point. So it could mean anything. It's whatever it means to you. That might be the model you want to use to structure your reflection, or you'll use the surprises, satisfactions, dissatisfactions, learning. So you'll use one of those two models of reflection, which I'm going to put back on the screen now as two models. So if you want to, if you're coming back this afternoon and you need to prepare, either take a quick photograph of that screen or do a print screen for yourself, whatever you want to do to make sure you know what models you've got and how you're going to use them. And you're going to come back this afternoon and you're going to say, I'm going to talk about such and such a thing. Give us a couple of sentences just to explain the context, and then go into the model. And I'll listen and I'll feed back and I'll write up the session so that you get to see how I would write up a group reflective session as well, because you'll also get the notes from it. So there'll be a couple of aspects of learning from it. I think just actually experiencing the session is valuable. In the slides that you're going to have, you will also have all of the references for what I've put into the slides today. And I suppose what I would say is thank you for your time. Thank you for your patience with the technology this morning. I'm going to stop screen sharing, just having a quick look in the chat if I missed anything, because when I was presenting, I couldn't see the chat. Okay. Mel Stokes is saying, how would you propose this could look in teams where remote working has led to very individual ways of working? I would say in remote working, use the reflective connections session, bringing people together online, because it works across very remote ways of working. That whole, so Mel, I don't know if you are coming back this afternoon, but if you are, I'm hoping the question that you posed in the chat will be answered by you attending this afternoon. So I'm just having a very quick look to see if there's anything else that I've missed. Okay, that's good. People saying they've got some ideas they're going to put into practice straight away. That's good. I'm very much hoping the slides will get to you with all of the pack. And obviously it's got all of those questions in there to use. But I think from my perspective, the key thing that I would say to you is, I suppose my three takeaway points are: always think about the what, why, and the how. When you've done supervision, does the person leave you knowing what they're going to do, why they're going to do it, and how they're going to do it? So what, why, how is really important. The thinking about using a variety of different questions in any supervision conversation, or basically any conversation with staff, because then you're modeling the model of asking different questions and motivationally and so on. And then the final one is try out reflective connections. It's a really good way of doing remote peer supervision, because you can't bring 10 people together in a room to have a group supervision, but what you can do is do a really powerful reflective connections session. Mel's saying she's not able to attend this afternoon, which is a shame, but hopefully that is what I would advise for remote working, is that session. So they're my 3 takeaway learning points, and it's bang on 12 o'clock. So thank you very much. It looks like Eloise has put a microphone on.
Thank you. That was just what I wanted to say. Thank you so much for especially dealing with the technical issues this morning, and managing to still have such an informative session. Lovely. Thank you.
Okay, thank you. I'm sorry, the bits that I whizzed through, I know I can send you, Eloise, some links to videos that I've done on that before. So that's why I whizzed through those bits, because I thought, well, you can always catch up on that elsewhere. So I'll make sure that I do send those links through. So thank you ever so much. Those of you who are coming back at 1 o'clock, you need to get off and get your lunch and get your thinking reflective cap on, ready for this afternoon. So but hopefully I'll see some. I'm seeing people are saying they're not able to attend this afternoon, but I think there was 20 people coming this afternoon, 2 lots of 10. So hopefully everyone who is coming this afternoon can still come. So fabulous. Thank you ever so much. I will end the session now, and I'm going to wave, because there's only Sarah that I can see, but I'll still wave at you, Sarah. So thank you very much. I'm waving at everybody else. I know I can't see everybody else, but thank you ever so much. Thanks for bearing with us this morning. Bye.